Yo, homies, you're watching Nurse Richard, the Wax Wizard, faux shizzle manizzle. Let's see wax babies.
Hello, good afternoon, good evening, good morning, and welcome. It's Nurse Richard, the Wax Wizard. Thanks for that, Snoop. Checks in the post. I'll call you later. You've never seen any of my videos before, and you're wondering why. What's he on about? Why is Snoop Dogg there, and what's he talking about wax babies for? I haven't said it for a while, to be honest, and I must get into the habit of saying it again because I do get asked in a lot of the comments whenever I pull a big one out. I think it all started when I think I pulled a really big one out in one of my videos, and I said it was like akin to labour. You know, the ear canal was dilating. I know it's not akin to labour, ladies, so don't shout at me for that. I didn't mean it. And I said and then someone in the comments, I forget who it was now, said it's like you've delivered a wax baby. And so ever since then, occasionally, and like I said, I've forgotten to do it recently, I used to say that's another wax baby safely delivered. So that's what Snoop's on about, if you're wondering what on earth he's going on about. Right, let me tell you about this here, because you've got to stick with this, because the payoff at the end of this one is sensational. And I don't say that lightly. It's not what you're expecting, it really isn't. And the visuals do get better than this. Now, this was a lady, I want to say maybe in her 20s, maybe early 30s, who called me up. It was in fact this morning. She was that desperate. And I managed to squeeze her in. This is always the case, this, when you take on an emergency one who gets really desperate. It turns out to be one of the most difficult ones of the week. But I'm glad I saw her, because it was a challenge. And what she'd done, you can probably already see on the outer part of the ear, just kind of on the bottom left there, a bit red. And her history was she used to get this done every 6 months. She used to live in Hong Kong, and as a matter of course, she used to get it done every 6 months because it became a terrible problem if she didn't. However, that was 4 years ago. She'd not did it in the last 4 years since moving to the UK. She hadn't found anybody suitable enough to do it. Thankfully, she found me, but it got to a point where she said, I need it doing desperately. Can't hear a thing. Obviously, you can see why. And she bought one of those ear cameras that you attach to a mobile phone, and it's got a little scoop on the end of it, usually a little blue rubbery scoop. Absolutely lethal. I don't recommend anybody uses them. You'll have all seen them advertised on the internet. If not, go and look them up. And I do get sent these quite a lot. Every couple of months, some company sends me one of these and says, please can you endorse this? Here's X amount of money, please can you endorse this? And every single one has gone straight in the bin. And I've never even replied to any of their emails. It's just a no. So if that's you, you're watching this video, you own one of them companies, stop sending them. I'm not going to endorse them. They're horrific devices. Anyway, let me tell you about the procedure itself. This is all done with a fine end tube. This ear was tiny. You may well see, as I've left some of the video in when I'm outside of the ear and the camera's approaching it and coming into the ear, just so you could probably appreciate how small this is, because that's the fine end tube, which is about 1 millimetre in circumference. It's absolutely minuscule. And it's this horrible type of wax which is really, really sludgy and mushy on the surface of it, but as I'm trying to work my way through the surface of it, I can tell that it's really squashed, and it's been really compacted underneath it, and that's the bit that I've just got to now. And it was so difficult to remove, but the payoff with this one was, those of you who know, there's a big surprise in the recess, and when I say a big surprise, I mean a big surprise. For such a small ear, I didn't realise quite how, you can see how tiny this is now, can't you? Yeah. I didn't appreciate how pronounced this recess was. Now, if you don't know what I'm talking about, basically the ear canal goes a little narrower before you get to the eardrum, and then it opens outwards like that. So it leaves these troughs, crevices, trenches, whatever you want to call them, surrounding the eardrum. And she'd rammed this thing, which was really black, she'd ram this thing into all these recesses, and after this, you'll only see a little bit of it poking around, and then it took me ages to grab hold of it and pull it out, because it's so firm and so hardened and kind of rubbery at the end as well, that trying to do that thing with a fine end tube is incredibly difficult, because it has very limited power. Now the machine is turned up on full power. I do get asked that a lot, and yes, it is on full power. But what becomes, you can just see it just beginning to lift up now, can you? You've just got to be patient with one like this. You might find it frustrating to watch, but trust me on this one, stick with it to the end. So it's just lifted up, so you can see a tiny little gap at the bottom. But what makes these kind of procedures so difficult, I mean, I can barely fit this fine end tube in there, and to fit you can't fit the endoscope in as well, so you can't really get that close to this thing. So the further in, I know I explained this on another video before, the further in you have to insert the fine end tube, the further out you have to hold the endoscope, because they don't fit together. So as soon as you insert one, the other one's got to come back if you want to insert that further in, if that makes sense. In fact, I'll go and get one. I'll show you what it's like in reality. Bear with me 1 minute. Should have got these ready, to be honest. So that's a standard sized tube. Let me take that out. Just see it, and again, another problem I'm having is there's no wiggle room in these things, because I want to move this side to side, up and down. I can't do that. Not very much anyway. The movements you'll see are absolutely tiny. And there we can see tiny bit coming out. Look how small this here is.
Yeah, definitely.
Good. And you'll see it's quite, now we can see half the eardrum now, but you've got this which is squashed into that recessed crevice on the left hand side. So that's a standard size tube. I'll put my hand against it so it focuses in better. So it's not massive, but it's not very big. And this is the fine end tube, and basically that goes, you push that in the end there, and it then becomes that big, which is very small. It's incredibly tiny. In fact, let me check the sizes of it in here. Doesn't actually say on the label. I know it is about 1 millimetre, there or thereabouts. Yeah, it doesn't say. They're small. You get the gist of it. It's difficult. But yeah, like I said, you can't really move this thing side to side when you've got a grip of it, and because it's so small, the suction power is limited, and so you really have to find a spot, let the suction probe stick onto it, build up the power, then start wiggling it, and then hopefully it'll come. I was actually surprised how wet this wax was. It might not have started like that, because if you know there are some genetic variants in the type of wax that you can get. So those of an Eastern Asian heritage are a bit drier, which obviously this lady was from Hong Kong. I think she must have been part, I'm making an assumption here, but I assume she was, because there's quite a large community in our town from Hong Kong. It's great that they came over here. I think it was part of I don't know if you call it a repatriation, but when, I'm not going to get political on this, but this is how it happened, how she came to be here. I assume, I think obviously when the Chinese, when Hong Kong was handed to the Chinese, a lot of the people in Hong Kong didn't want to stay there anymore, so I think there was a scheme in Britain where they could repatriate and come and move to the UK, which a lot did, and there's quite a large community of people from Hong Kong in our town, and a lot of the kids at the schools, a lot of my kids have made friends with them, and it's great that it's so diverse, you know, experience a new culture for especially the younger people. I know it's frustrating. I know it is. Stick with it for the payoff, I promise. I'm just watching it myself thinking, oh my word, that looks difficult. And it was because I just can't wiggle it. Could barely get hold of it because it's so stuck down in there. But you just can't wiggle it. It's really, really difficult. And it's always the way, like I said before. If you say, oh yeah, I'll help you out, no problem. Come in and I'll squeeze you in between a couple of patients. Thankfully, the patients either side of it were really simple. Don't forget, if you are enjoying this content and what I do, then feel free to follow the channel. So many people watch these videos and they don't follow the channel, which really helps me out. Really, it's all about algorithms, isn't it? I don't understand fully how they work. But I know if you're pressing like when you watch a video, it gets recommended by the algorithm to more people. So the more people, more of you that are watching it, you click subscribe, which doesn't cost anything. There you go, there's a little thing above me, perfect timing. The more of you that press subscribe to the channel, which doesn't cost anything, it just means that whenever there's a new video out, if you click the bell, it'll tell you when there's a new video out. But I can tell you that now, so you don't have to do that. It's every 2 days. But I would appreciate it if you could. I think we're not far away from getting to the payoff on this. And again, I'm looking at it myself and thinking, I don't know how I'm going to quite do that. Because bear in mind, when I'm doing this, I'm watching it on a really small screen. It's this size, tiny circle on there. And I'm having to look right in the centre of that, at the very tip of that tube. So yeah, your heart sinks when you get one like this. It really does. And I think every now and then you come away just to give yourself a break, to be honest, and the patient a break, because the tension that you have to put in your hands, you know, that muscle there on my thumb, it's rock solid. It's probably the strongest muscle in my body because it gets tensed that much when it's squeezing these things really tight and doing these really fine movements. But I think all of a sudden, I don't think it's far from now, all of a sudden you'll just see it give way. And you'll probably be thinking, same thing I thought, and the patient, when this comes out. And you'll be like, huh? Where's all that come from? What a shock. Which it was, you can see it coming out now already, can't you? But watch how much more of it comes when it finally lifts up. Look at the base of it. And this isn't all of it, by the way. It was still really small, though, in real terms. But for the size of the area that it was fitted in, or fitting, whatever the correct grammar is, I just wasn't expecting it when it all came forward. I'm like, where's that been? It just looked like a tiny little, it's a tiny little semicircular shaped area just tucked in. And even when this bit comes, there's still more that gets brought forward after this. But I wasn't going to take a picture of it and lay it on a ruler. You'd be disappointed because in reality it's still a tiny thing. But because this ear canal is tiny, it's probably less than 0.5 centimetre wide. Probably even less than that, to be honest. Like I said, if the fine end tube's about 1 millimetre. I have got a nurse joke of the day ready, but I'm just finding myself a little engrossed in this again. There you go. I can finally see an eardrum. I'm going to a little bit of tidying up, and the second one is her other ear, which was a lot bigger, thankfully, so I could get the full. It's very sticky, but I could get the full size tube in that one. Moral of the story with this is, though, stick with it, be patient, and you will get a payoff at the end. But the other moral is, please don't use those ear tools, those cameras with the little scoops on. Please don't use them. Right, I've got 2 in here, and they're really, really good ones. They really tickled me. Too many risks involved. So you can have 2 of them. Right. A man came to hospital with 70% burns, and the ward sister says to the nurse attending him, give him a Viagra tablet. But the nurse asks, do you think that Viagra will help? And the sister replies, no, but it'll keep the sheets off his legs. This other one's good too. Right, so a handsome young man went into the hospital for some minor surgery. You'll find out what in a minute. And the day after the procedure, a friend stopped by to see how his pal was recovering. And while he was there, his friend was amazed at just how many nurses came into his room every few minutes with refreshments, to offer to fluff his pillows, check his temperature, to make the bed, make him comfortable, and so on. And he said, "Why are you getting all this attention?" He said, "You look fine to me. You don't look ill at all." The smiling patient replied, "I think the nurses formed a fan club when they heard that my circumcision required 14 stitches." Enjoyed that. Oh, do you know what I forgot? Bear with me. There it is. Anyway, I hope you enjoyed that. Like I said, please feel free to follow the channel. I would appreciate any new subscribers. But for now, take care of yourself, and I'll see you soon. Ta-da.